Can inflammation cause depression? This may seem like a peculiar question, but recent research suggests a profound link. Today, we delve into the growing body of evidence that points towards inflammation as a potential contributor to depression. This link is particularly strong in individuals who grapple with pre-existing inflammatory conditions or chronic illnesses. In the world of medical research, striking correlations have been observed. For instance, the connection between inflammation and depression is commonly seen in instances of autoimmune diseases such as multiple sclerosis and infections like sepsis, where the immune system plays a significant role. Yet, it's crucial to remember that this is not a one-size-fits-all scenario. Everyone's health journey is unique, and not everyone with inflammation will experience depression, just as not everyone with depression experiences inflammation. However, the connection between inflammation and depression is too significant to ignore. This connection opens up new roads to understanding and potentially treating this widespread mental health condition. So, how exactly does inflammation trigger depression? Let's dive into the science behind this. When our bodies encounter harmful stimuli, they respond by inflaming the affected areas to protect our health. This inflammation can become chronic, especially in individuals with autoimmune or chronic health conditions. But what does this have to do with our mental health, specifically depression? Well, chronic inflammation can have a domino effect on our central nervous system and brain chemistry. Imagine your brain as an intricate network of neurons, sending and receiving signals to regulate our emotions, thoughts, and actions. Now, introduce chronic inflammation into this equation. It acts like a disruptive force, creating a storm of chemical reactions that can alter this delicate balance. For instance, inflammation can trigger the release of certain proteins called cytokines. These tiny warriors are usually beneficial, helping our bodies fight off infections. However, when they're overproduced due to chronic inflammation, they can cross the protective barrier of our brain, causing a ripple effect. They may interfere with how our brain produces and uses serotonin, a key neurotransmitter associated with mood regulation. This interference can lead to a decrease in serotonin levels, which is often linked with depression. Additionally, chronic inflammation can impact the function of our brain's hippocampus, a region associated with memory and emotion. This can lead to cognitive difficulties and mood disorders, including depression. The complex relationship between inflammation and depression varies among individuals, but the impact on mental health is undeniable. Recognizing the link between inflammation and depression can have significant implications on how depression is treated. It's a fascinating interplay of our physical and mental health that we're still unraveling. When it comes to treating inflammation-related depression, it's not as straightforward as popping an anti-inflammatory pill and calling it a day. The treatment typically targets both the underlying inflammation and depressive symptoms. Imagine this as a two-pronged approach. On one side, you have treatments aimed at reducing inflammation. This could involve lifestyle changes such as adopting a healthier diet, regular exercise, or perhaps even medication to manage an underlying condition causing inflammation. On the other side, you have treatments aimed at managing depressive symptoms. This could involve psychotherapy, medication, or other treatments as recommended by a mental health professional. The key is that both aspects are addressed simultaneously to optimize the chances for recovery. If you suspect that inflammation might be playing a role in your depression, or if you have an autoimmune or chronic health condition, it's crucial to seek professional help for a full assessment. This isn't something you should try to tackle on your own. Professionals can provide specialized medical tests and assessments to determine if inflammation is contributing to your depression, and they can help develop an appropriate treatment plan tailored to your unique situation. Remember, understanding the cause is the first step towards effective treatment. If you or someone you know is struggling with depression, reach out to a healthcare professional. Like and share and comment and subscribe.